The Bronx is the northernmost borough of New York City. More than half of the 1.4 million people who live there are Hispanic, and almost a third were born outside the U.S. Nearly 30% of its residents are living below the poverty level. The borough faces many challenges, yet thanks to significant redevelopments and the combined efforts of community partners across all sectors, the Bronx is becoming a symbol of hope, prosperity, and vitality.
To some degree, some people may have this negative perception, negative stereotypes of the Bronx when it was burning. The Bronx at that time was dilapidated, it was war-torn. It was the national model of urban decay. But that's no longer the case. Those negative images, those negative stereotypes no longer apply. We are booming.
The culture of health to me is a place where people work outside of their unique silos to complement each other, to have greater collective impact on the issue of health and wellness. You can't just be a hospital system and think about just providing treatment. You've got to be a hospital system that thinks about providing the community with the tools it needs to be healthy.
New Settlement actually was established to revitalize different communities throughout the city, and the idea was to create housing that was affordable to families of low and modest income. Opening in 2012, we completed the New Settlement Community Campus, 172,000 square foot state-of-the-art building that houses 3 public schools, and also the New Settlement Community Center, which offers to neighborhood residents things that have not been available here for many years. I think from the outset there was a recognition that kind of rebuilding the neighborhood with bricks and mortar was important, but that it was equally essential that work be done to bring back to the neighborhood the vitality that once existed.
This is where we have our farmers market, one of many sites here in the Bronx.
In the Bronx, we have close to over 150 community gardens. I think for too long, I think the urban sort of realm has been out of the conversation when it comes to food and health issues. And I think what urban agriculture and community garden has done is really bring it to the forefront.
Can someone tell me something strange about the tomatoes that they see over there?
I would say maybe about 5 years ago when you'd ask a child where a tomato came from, they would tell you from a grocery store. Something was wrong with that. But I think when people actually see, when they put a seed in the ground and they put soil on it and they water it, all of a sudden that seed grows into the fruits and vegetables that they commonly eat.
They're good.
So all of these things are interconnected. We have many health challenges, but we've made a lot of inroads and we continue to work with many partners.
Montefiore understands that we don't just need to deploy doctors within the 4 walls of our hospital. As a physician, my primary focus area is actually the community. I focus all of my work at getting ahead of the disease. How do I prevent diabetes? How do I prevent asthma? We actually want to figure out how to keep people well and out of our operating rooms and out of the emergency room, because that's not good for their health.
Now you're sure.
South Bronx Rising Together is a collective impact partnership focused on ensuring that all young people in this community are able to reach their potential. Asthma is actually the health issue that contributes most to chronic absence from school. So we came together collectively in 2014, bringing all these partners together to say, how are we going to measure a real change in child health over time? And so the folks around the table really helped us identify as the core indicator we would look at is asthma-related hospitalizations and asthma-related ER visits. And so what we do now is really bring together experts who really understand the relationship between child asthma and education.
Because I'm a teacher.
And look together at projects that we can take on that are going to make a difference in reducing asthma-related ER visits and hospitalizations.
Health isn't just about getting your vaccines and your treatment or taking your medications. Health is about how you care for your body. And it's everything from stress release to exercise to getting out and getting fresh air.
The Haven Project looks at different access points or potential green spaces or places that could be great recreational places for this community. That's to create a running path, a bike path that would help to reduce body mass index, that would help our community be healthier, both mentally and physically. If it takes 2 years, 5 years, 10 years, every step we take is bringing us closer to that final vision.
Our organizations are focused day in and day out on reducing poverty in this community. It's not a single focus on health, it is health in the context of education, poverty, jobs, housing, environment. I think we can make a difference.
Over the last 20 years, the life expectancy in the Bronx has gone up much faster than the national rate has. Ultimately, I think that's one of the leading indicators of health. I mean, do people live longer? And they certainly do in the Bronx.
So we're the little engine that could. We are the ones that were written off in the past. I mean, take a look at what the Bronx was like in the 70s, 80s, and the early 90s. If we could get to the place where we are today, anybody could do that.